Kristen Ulmer for coming on there last week. If you did listen to it, I hope you enjoyed it. It was a fascinating chat about, she's an extreme sports Hall of Famer. She did some crazy things on skis that I looked up on YouTube and, gave me a panic attack. But then she also wrote a book about fear and how we should, it's an interesting one. I was like, to be honest, I was a little bit disappointed in my performance during the interview, but I thought Kristen put her points across very well. And I read the book and I agreed with a lot of it, but not all of it. So yeah, have a read or just have a listen to the podcast and make your own mind up. But also thank you for your support during the week. As always, you're getting the podcast out there for us. So it's great. I want to introduce this week's guest, someone who's going to come on and talk to us and fill us in a little bit about something that's, I don't know if it's everybody knows what it is. People have heard about it maybe and haven't really looked into it, but we're going to talk a bit about it. And our guest this week is Sinead Fagan. How are you doing, Sinead?
Hi, how are you?
I'm very well. Was that, I promised before I hit record, a professional introduction. Did you find that quite professional?
It was professional, yeah.
Oh, thanks very much, Sinead. So what we do, as you know, what we always do is we start off with a couple of questions that, in every podcast. So could you give us a short history of your upbringing, please?
Sure. My upbringing was tough. It was my mom and my dad split up before I was born, and I was raised by my mom and my stepdad. My mom, she's a tough woman, to say the least, and we don't. Her methods of raising children are somewhat questionable.
Okay, all right.
We don't have the best. We don't even have a relationship anymore. So.
What about, where are you from? You're from, I should say, you live in Mullingar. Are you from Mullingar?
I am, yeah.
And you, your whole life growing up there, school there, all that?
Yeah, school, everything. It's a very small town, but I'm sorry, I'm a little bit nervous now.
No, you know what I was going to bring up, if you don't mind me just mentioning there's a slight, if people don't know, and maybe from outside of Westmeath, maybe there's a slight little rivalry between Athlone and Mullingar.
I know.
It's almost for the to battle for the capital of Westmeath, which is obviously a huge prize for any town.
Oh yeah,
it's massive, and it's interesting. I live in I'm still in Athlone, as you know, but I'm over the other side now. So I'm in the Roscommon area.
The Roscommon side, yeah.
So now I'm trying to wonder, I'm wondering, it's an interesting thing when you talk about Mullingar and Athlone, because there's not many counties that, of the smaller counties that have a rivalry between two towns. It's a kind of a strange one. And I don't know why you'd want the mantle of capital of, but do you actually, no, do you know what a question I should ask really? Do you like living in Mullingar?
Yes.
Well,
I do.
That's all that matters then, isn't it? But can you, so for our second question, as always, so when did you first become aware of mental health?
Oh, I was very young, very young. I mean, look, like I said, my mother is a very, very hard woman, and she was very hard on me as a child. But so I knew that I was aware that she possibly had a few issues. So, I went through a lot growing up, a hell of a lot growing up. So it's not something it was just normal, and then I started getting very, very depressed when I was 13. When I hit puberty, I just started getting horribly depressed, and there was a death. A very close friend died. That didn't help. So I've always been aware that people have their stuff.
And when you say you're quite young to be experiencing depression, did you know at the time what it was, or was it? Did you feel that, like, because 13 is quite, quite young,
Yeah,
and I think at 13 I wouldn't have known what depression was, I suppose. But like, again, it's backgrounds as well.
yeah, this is the thing. I didn't realize I was depressed. I
Mhm.
didn't have a clue. I knew I was very sad all the time, but I didn't have anybody to help me,
Yeah.
so I never really thought about it. Um,
Did you?
my,
Sorry, go on.
no, go ahead.
I was gonna ask that. So, um, that was something that affected you growing up, and we're going to talk a bit more about going into different. We talked, myself and yourself, off the podcast, obviously, about like being
Mm,
misdiagnosed with stuff, and it's a pretty common thing, I guess, to be
mm.
misdiagnosed with something. But as you were getting older, um, at any point did you go to a doctor to have a chat? And if you did, what age were you?
No,
You didn't.
no, no, I never saw a doctor. I never spoke to anybody about it. I was too afraid to. For a start, I was never having emotions, having feelings. Um, my house growing up, I wasn't allowed to have feelings.
Yeah.
I had to suppress pretty much everything that I ever felt, you know, uh, even happiness, it's very, the damage that it caused, you know, growing up, I wouldn't, it's a horrible
Mm.
illness. It really is. And the fact that it's caused by trauma in childhood is, it's tricky,
Uh,
because you grow up thinking that, knowing that there's something wrong in your
yeah.
family, and not having any power. You're a child. But there was one moment I remember, and I'll never forget it as long as I live. I would have been maybe 8,
Mhm.
and I remember asking my mother whether or not she loved me. Now, no child should ever have to question that. No child should ever have to ask if they're loved. You know, um, it's yeah. Um, there's a lot of damage. There was a lot of damage done to me, to my mental health. And when I was 17, I had a psychotic break.
Mhm.
And people who have BPD are at risk for psychotic breaks. Um,
Can I,
yes.
if you don't mind, can I just read out, because I just wanted for because obviously we're going to hear your experiences of it, and it differs with the people, obviously, like any condition or disorder or mental illness. Um, I just wanted to read out the description of it, so give people some idea of what borderline personality disorder is. So, um, it's personality disorder characterized by a long-term pattern of unstable interpersonal relationships, distorted sense of self, and strong emotional reactions. Those affected often engage in self-harm and other dangerous behaviors due to difficulty with returning their emotional level to a healthy or normal baseline. They may struggle with emptiness, abandonment, detachment from reality. There's a number of obviously there's a number of symptoms, and I'm not going to go into what I have here, but we can talk to you about that. And there's quite a large number when it talks about some 8 to 10% of people affected may die by suicide, which is a huge percentage of people. And then it goes on from there, talking about the how the causes are quite unclear. Like you mentioned trauma there, and you talked to me about that before. And it says the causes maybe genetic, neurological, environmental, or due to social factors as well. So I just wanted to give people an idea of that. So, with your experiences of BPD, what were the symptoms that you kind of felt early on?
Well, thinking about, like, looking back on it, that's that's a fair description of
Mhm.
it. There's unstable emotions. When you're told, when you're forced to suppress your emotions as a child. As you get older, you don't know how to, you know, handle normal human emotion, you know, so you're kind of learning all over again. Yeah, extremes in behavior, mood swings, severe depression, you know, having no trust in anybody. That was a big thing, you know, that was a big thing, you know, because when you feel so unwanted, you know, and you're constantly being told that you're unloved, that nobody wants you, that nobody, you know, that, you know, that caused severe depression in me. Suicidal thoughts, yeah, absolutely, constantly. I mean, it's not even as if it's, you know, you feel suicidal and you talk to your doctor or whatever, maybe you get something for it, but it's become part of my psyche at this point, you know. When I'm not feeling depressed or suicidal, it's unsettling,
right?
You know, because it's not. That's the way my brain is wired, you know.
Yeah,
and it's a very, very hard illness to navigate. You know, it really is.
It's you know, reading up on something like that, and not you know, not having the disorder. There's so many. Your dog is very cute, by the way. Is it a he or she?
That's a he. That's a
Yeah,
he.
I could spot him. There he is. But you know, when I was reading up about it, the amount of different you know, symptoms, or you know, or even when they talk about causes, like you know, a lot of people misunderstand, I think, what it is. And you spoke to me about being misdiagnosed early on. What were you diagnosed with?
Oh, look, I was diagnosed first. I was diagnosed with schizoaffective disorder. I was put on a bunch of medication for that without even any clear, you know, that was the official diagnosis, day one, and they put me on a bunch of medication. That completely messed me up even more so. Then I was diagnosed with schizophrenia,
Right.
then bipolar, and that went on for 7 years. All the different doctors, all the different medications, hospitalizations, suicide attempts, this horrible, horrible experience. And what happens when you're, you know, when you're put on medication and you're taken off it without being weaned off it, it causes horrible side effects. And that's what was happening to me constantly. So while I was trying to manage what I thought was my diagnosis, I was having to manage withdrawal symptoms and being on wrong tablets and the horrible side effects from them. You know, not just, you know, I was wondering, why am I still feeling this way even though I'm taking my tablets?
Yeah.
Yeah, that went on for 7 years. 7 years.
There's like, you know, and I'm sure it's well, common is probably the correct word, but I'm sure it's for a lot of people it's happened in that way, where they have been misdiagnosed, and some of the symptoms kind of cross check off each one as well. So it's like, you know, yeah, like bipolar disorder. When I was reading that, I've spoken about bipolar 2 on here a number of times and had people coming on to talk about it. And there's certain traits within it that are, you know, similar. But there's also ones when you read on anything about BPD that don't cross check over. And, you know, that's where I wonder where the failing is to spot, you know, between bipolar and BPD. Because like you said, if you're given medication for bipolar that has nothing to do with BPD and is not going to affect it, it's obviously going to affect a different part of your brain. And it's going to, like you said, the thing that's kind of scares me a little bit about what you said and what I've read is that the heightened emotions, because the heightened emotions can be there with bipolar as well. But it's not that, you know, obviously it's not the same diagnosis. And you talked about when you were young, when you weren't, you know, you had to be numb, almost like you couldn't have those feelings. And to have this kind of, when you were growing up, to be numb, to be told not to feel anything whilst you're having heightened feelings, then you're going into a system that's dealing wrongly with what your diagnosis is. I can't imagine what's going on with your head. It must have been like, and you said about hospitalizations, there could be really no other way that you could have gone, really.
No, I mean, they had absolutely no idea what they were doing.
Mm-hmm.
You know, they really didn't. They should have handled that so much better. I was very young. I was 17.
Mm-hmm.
You know, I wasn't even an adult yet. And they were treating this like, I don't know, they were just throwing medication at me, throwing diagnosis at me, and to see what would stick.
Yeah.
And that's not how anybody should be treated. Anybody that's going through any kind of a breakdown, there needs to be a proper, you know, they need to take more time to actually not research, but speak to this person, to understand them, to actually know what's going on, because it is very easy to misdiagnose people, but these are professional people who should know better.
Yeah.
And unfortunately, sometimes they just don't. It's ridiculous, actually.
It is. And what I found disappointing, really, Sinead, was like when I was in the system, and you know, I understand that they're understaffed. I get, I do understand that point, but when you're dealing with people who are very vulnerable, emotionally vulnerable, and you tell them to wait 3 months, for example, for an appointment, and when you get into the appointment, it feels like the most rushed, you know, consultation you can imagine. And in my
and that's even if you know, that's if you're lucky enough to actually see your doctor, not a random doctor.
That's another problem, isn't it? Like, because when I was going in and out, it was a different person every time. You can't establish any kind of relationship every time. You know the frustration, actually, that started to build up for me. Every time I went in, I said to the doctor said to me, "What medication you're on?" And I was like, "It's all written down. I can't, every time I have to read out the same." And that was just one little thing that really started to bother me, you know. And I don't know if you felt that, like you just mentioned there's a lack of connection because you don't get to see the same doctor, and you feel like, you know, one day you're going in, you might feel all right. You mentioned about like heightened emotions. You might be feeling great, you know. The next doctor you see, you might be feeling terrible. You might be feeling sad. The next, you know, you move to different ones. There's never going to be in like a connection. The doctor's not going to be able to connect the dots to, you know, a diagnosis, really.
Exactly. Yeah, this is it. And they know it's wrong. Sure, look, they know themselves that it's wrong. They shouldn't be doing it. But I mean, there's, what's the term I'm looking for? But there's it's almost as if people with mental health conditions, illnesses, were not treated with respect by the people who are supposed to be taking care of us.
Do you think that because we, like, there's a lot of people talking, it's great that there's more people talking about mental health, like it is brilliant, but do you find, like, this might be just my own idea, but do you think it's because that they see the people who have mental health problems as the ones that aren't going to speak up? They're going to be quiet and kind of put up with what they have to put up with.
Yeah, that's it, exactly. They target a weakness and exploit it, basically, because there's no, you know, what are you going to do? You're going to, you know, if you even do go to a solicitor to say this is wrong, or even go to anybody, you know, in a position of power that could possibly help you, say this is wrong, what proof do you have? You know, they have their little notes that they write down, and you've no idea what they're writing down. This is the thing, you've absolutely no idea. And they almost, you know, there was one doctor in particular who, and he did it to all the female patients, just the female ones. He would deliberately try to provoke us and start arguments with us. you know, for example, there was one day in particular, and I couldn't take it anymore. I was there to get better, and he was just making me so much worse. I was in an appointment with him one day. I was in the hospital, and he was like, you know, on a scale from 1 to 10, how do you feel today? And I just went, on a scale from 1 to 10, you can kiss my arse. I did. It's on a scale from 1 to 10. How are you feeling today?
Yeah.
I'm in a mental hospital. I'm not doing great. But
I always
he was terrible.
I always found those scales very patronizing.
Oh, so patronizing.
Because
oh my God,
it's like it was like, you know, when you went to, if you were to the doctors or the hospital with an injury, like a physical injury, and they'd ask you on a scale to 1 to 10, how sore is it? And I always was like, I don't like, what's the 10 scale? I don't know what that means. It doesn't mean anything.
It doesn't mean anything. This is the thing. It doesn't mean anything. It's completely pointless. I think it's there as a joke, actually, because look, they have a hard job, but maybe they just need a laugh. I don't know, but it is so stupid. You could be in with your leg hanging off, and they'd ask you on a scale from 1 to 10 how much pain you're in. It's just stop.
Yeah, it's an odd thing to do.
Saying.
Yeah, the scale thing is very odd. Can I ask you then about, because I actually started back in therapy today, and it's been, God, it's been years. But I just thought, I don't know if I said it to you the last time we were chatting, but I just kind of needed a top up with regards to OCD, and OCD was making my anxiety quite high. So I thought I'd do a little bit of a top up. Now it's a private one. I wasn't going back into the HSC again. So I said,
oh God, yeah.
I said I'd do the private one. Did you go through different forms of therapy?
I have. Look, I haven't been to therapy in years. It's very, very hard to find somebody.
Yeah.
You know, that's I guess experienced, because for this kind of thing, for personality disorders, look, I don't know about, you know, other types of personality disorders. I'm not, you know, too well, I just don't know that much about it. But you need a specific type of therapy for BPD. And it's very hard to, especially with the experiences that I've already had, you know, with the HSC. I don't really trust it, but then again, it is important. You know, I probably should be in therapy. I definitely, in fact, I should be in therapy. But I've tried that what's it called?
Did you do
cognitive behavioral
therapy?
Yeah. I tried that once.
It didn't stick, no?
No, I didn't like the therapist.
Oh, you see, that's like proves what you're saying, because I did it 10 different sessions, and he was brilliant. He was absolutely brilliant. And that's when you want to go back, because the person's cool and you think, okay, now they're going to help me. And it's about finding it, like, again, and the reason I asked about the therapy, really, because when you were misdiagnosed, were you recommended to go to a therapist of some sort? Was it just that, the CBT? No.
I wasn't diagnosed. No, I wasn't diagnosed with BPD until I was 24, and before that, they were the same doctors, you know, at different points, telling me that I had all of these different conditions, that, you know, and that this is the thing. It was the same doctor that had diagnosed me with schizoaffective disorder, that diagnosed me with schizophrenia. So, and how he could justify just switching my medication, just one after the other, no, you know, time for me to let my body process it, my mind process it, nothing. It was just boom, done, you know. And so I think I have a very deep distrust of therapists.
It seems like obviously the fact that you were quite young, they felt that maybe, and you had you were going through stuff that, you know, it was easier to do that to you, like where they may not have done, they wouldn't have done it to you now, like.
No, they definitely wouldn't have done it to me now. No, I'm much wiser now. But even back then, I wasn't all right with it. You know, even back then, I would get annoyed with them. I got very annoyed with them one day over in the clinic here in town. You know, when I wasn't seeing my own doctor, and she was very bitchy and very, you know, I just wasn't having it. I said, look, this isn't on. I said, and you know, I said whatever it was. I said, you know, the way you're treated by these people is absolutely disgraceful.
Yeah, it's
nothing short of, you know, disgraceful. I mean, and to do it to a young person as well. You know,
it seems as if, you know, and I've talked about this a number of times, and I was so lucky. The morning that I had the breakdown, that I was brought to a doctor who I'd never seen before, by the way. He was just happened to be the one that was free, and he couldn't have been nicer, and he helped me all the way through. And it was just obviously a case for me that I just got very, very lucky with who I was landed with, because when I was going through the HSC system with regards to the therapy, you know, I would have had similar experiences to you, where some were just very, very cold, and you know, you would assume, and I know assuming anything is a mistake, but you would assume that all doctors would have good personal skills.
You would think so, yeah.
But they don't.
I mean, it's kind of an important part of the job, isn't it?
It should be one of the most important parts of the job, really.
Yeah.
But listen, do you mind actually, before we're kind of stuck in this really good conversation, and now I have to ruin it by putting an advert in. But you know, somebody's got to pay the bills, you know.
Absolutely, that's fine. Go ahead.
Cool. Okay, so Fusion Training Centre, Monksland, Athlone, a place to train in Brazilian Jiu-Jitsu, kickboxing, martial arts, and CrossFit. A great atmosphere with experienced coaches and a real sense of community. If you want to join the team, find us on Facebook at Fusion Training Centre or drop in for a chat. Fusion Training Centre, train like a warrior. Yeah, the women's classes are still ongoing. Well, they will be ongoing from now on. I don't know why I keep saying that, but they're every Wednesday and Friday evening. If you want to get in touch with Fusion, I am the coach. If that interests anyone, but it's good crack. They're progressing very quickly, and they were actually killing each other last night, but in a non-lethal way, obviously. So can I ask then, if you don't mind, how BPD affects you know, personal relationships? And I don't mean just romantic, I mean just relationships in general.
Oh, look, trying to form a bond with anybody is incredibly tricky. You know, we're let down, we're neglected by the people who we're supposed to be closest to in the world. So it's very, very hard to form meaningful and long-lasting bonds with people. We do have severe abandonment stuff. That is a major part of it. The abandonment issues. That's something I'm still working on. You know, it does cause a lot of problems in relationships. You know, too many problems. I
was gonna actually mention that, just because we had Sean Keys on. It was a long time ago now. We had him on talking about BPD, and he did mention about he had severe abandonment issues. And look, even when he was talking about you know, he's married, he's kids and stuff like that, but even then, when you think, you know, someone is settled down and they, you know, they have it made, and they're, you know, it's not the case. And what we see, or what other people see, can be completely, you know, wrong. It's just, we see, you know, we think that the person is secure and stuff, and I can't imagine what that is like, that a kind of abandonment issue. I can't. Is it a case of like, and I don't mean that you're pushing people away on purpose, it's just the nature of it, but because it sounds like it's something contradictory if you push someone away, but then you've got abandonment issues because they're not there.
Yeah, it's much easier to push somebody away before they abandon you, or before you think they'll abandon you, you know.
So you're preempting it.
Pretty much.
Yeah.
Yeah.
Which is you know, looking from the outside in, which is, you know, pretty sad to think that someone's, especially when you try to imagine that the other person is, you know, wants to be there for the long haul and stuff, you know, that they're actually, you know, and that's not, you know, and they will probably realize that it's not on them. Do you get the kind of, not off everyone, but off some people who may know that they treat you slightly differently?
Yeah.
In a negative light?
Yeah.
Oh.
Look, there are people who have had some truly horrible things to say about me. Never to my face though. Which is, you know, if you're going to say something to somebody, you know, be upfront. But there have been, you know, because I was so young when I went into hospital as well, and you know, when I went back to school then the following year to repeat, I couldn't stay. I couldn't stay in school because of all the things people were saying about me and to me, and you know, oh, I heard such and such a person was saying this about you. I'm like, but that's not true for a start. I didn't leave to have a baby and then give my baby up. That's not what happened. I swear to God, the stuff people have made up about me is absolutely insane. And look, I mean, I spent most of my 20s in a manic state. I was completely out of control. Like nothing bad, but just I was taking risks I shouldn't have been taking. Very, very, you know, not dangerous stuff, but just stuff I shouldn't have been doing. I think the people who are in my life now, you know, they understand that I have a condition that needs to be managed and that it's difficult, you know, and I can talk to these people, you know, I can talk to the friends I have now about this stuff. But what I found with other people in the past, and especially members of my family that I was very close with, when you have any kind of emotion, when you do, you know, have a reaction to something, you almost feel as if you're not good enough to feel a certain way. And it doesn't matter what the emotion is, if it's good or bad, you know, although when it's bad, you feel like you do deserve this. You know, there's always somebody there, you know, or are you going to break down again? And, you know, that's, it's like, no, you know, I'm upset and I have a reason to be upset, you know, but what happens is that's taken and twisted and thrown in my face then. And like, that has happened to me a lot with people.
It sounds like they expect you to be, what expression is probably best, but like on a level.
They don't want to deal with my condition, but they don't have to. It's mine to deal with, you know what I mean? And they take it upon themselves then because they want to be, it's a victim mentality, you know, I think with people, they just want to, you know, have something to give out about or have somebody feel bad for them for something in some way. Look, I went through it with my mother.
I like,
you know,
it's beyond, it's, you know, those kind of things are out of your, you know, control. And I the reason I asked that question, because I know that, you know, fortunately enough, there haven't been many people, but there's been one or two when they found out about my, you know, anxiety and depression, you know, bipolar or whatever, they have kind of stayed clear, you know, as if I was some sort of like volcano ready to go off or something, which couldn't be further from the truth. Which I'm very quiet. You know, and it's a funny way of kind of looking at it, but then I wonder, you know, if I swap positions with the person, would I be thinking that too? Like if I hadn't experienced, I don't know if the empathy is there because I've experienced something.
It is, well, do you know what? Probably it could be. You could just be, you know, you could already be an empathetic person. You know, well, obviously you are. I mean, you do a podcast where you openly talk about mental health. You know, it's fantastic. It does. I think having a mental health illness, having any kind of condition, it does make you a lot more open-minded, a lot more understanding of people. But what it also does is, well, in my case, it's given me the ability to see through people so easily.
Right.
You know, so easily. And I just don't have time for people's shit anymore.
And yeah,
I just don't.
But it does, that comes like, I don't know, as you move, like as you move into your 30s, I don't know if that's like, if that's just something that comes. And I wanted to ask, because you mentioned about like being in your 20s and you know, being manic through your 20s. Yeah. How does, like, because I don't drink anymore, I've given up drink. How does alcohol affect something like BPD?
Oh, sweet Christ.
Oh, it's bad, is it?
That's the only answer that I need to give you. Oh, sweet Christ. Because
everything you said, or everything I've read off the phone there, and everything you've told me about heightened emotions and stuff, and immediately I'm thinking, what does alcohol do? Oh, heightened emotions is definitely one of them, you know. And
yeah, it gets bad. It's look, it's, I enjoy a few drinks. I go out and I have a few drinks, but if I drink all night, I'd be completely manic. Alcohol turns me manic. It does. Just, I don't know why. It really does. So I'd have to smoke a bit,
right,
to kind of level myself back out.
Yeah, and that's
which helps actually. Which helps a lot.
I wasn't going to bring that up unless you brought it up, but
yeah.
Just look, and we've had people come on and talk about smoking before. It's not like, you know, a big deal. But
I know, but it's yeah, you know, some people can be funny about it.
Oh, my dad will be very disappointed. I know, but but does that? No, he won't. But does that take the kind of edge off?
Derek's dad.
Sorry, Pierce. We apologize for this little piece. Just turn off for a minute as I ask another question about.
Yeah.
But does that take the kind of edge off? Does that help?
Yeah, it's the best thing I've ever taken for my BPD. Yeah, smoking. Yeah, 100%. Cannot recommend it enough for BPD.
Well, and and the reason that's kind of mind blowing is because, you know, when you hear about people, there's so many reasons to smoke, you know, to help. And look, it's for a lot of different things, and pain as well. You know, and we don't just talk about mental issues and stuff, but I didn't put the two together, cannabis and BPD.
Yeah, well, I don't know. I never really look. I don't read up about BPD that often. You know, I have it, so I don't really feel the need to research it.
Yeah, that's
fair. You know, it's interesting to learn about different personality disorders. I do love a good personality disorder, I have to say. But I do. It's interesting. Mental health is a really interesting thing, and we need to talk about it more.
Yeah.
You know, but yeah, cannabis definitely helps. But it helps me anyway. You know, with my depression, insomnia, my nerves, especially. I'm not. I think I might have a touch of agoraphobia.
Really?
Yeah, I don't know, but it's weird because I'm claustrophobic.
Oh no!
So I swear to God, I think it's just. It's just the anxiety of having to leave the house and be productive and deal with people, because it was that Tommy Tiernan has the same condition, and what he said about it was fantastic. The way he defined BPD was, I'm not good alone or with people.
Yeah,
so
in between.
It's in between. It's somewhere in the middle there. Yeah.
But I actually didn't even think of it as a help, and I know it does help a lot of people with anxiety. Is a big issue, and it does help a lot of people with anxiety.
People are a mess.
Yeah, it's you know, it's unfortunate how it seems to be, you know, on the rise, and for many different reasons. And it's interesting that, like, agoraphobia is one of those things where you think, is it that, or is it the anxiety that? Because some days I just don't want it, and I kind of push myself. And it's funny, like the OCD, which I'm actually trying to help myself with. That's the thing that gets me out the door, because I have to go do something because it's in my mind, like go train or whatever it might be. So it's a really it's a conundrum. I'll have to figure it out myself. But can I ask you actually, because what are the tattoos? What do they represent?
Oh, I've got a ton of them. This one is just a little tribal thing
Yeah.
that a friend of mine did. This one, they're banshees. I love
Okay.
Irish folklore and everything, so they're my banshees. I have some cherry blossoms here. That's a cover up though. That's the first part of a cover up.
Ah,
And then I've got some more cherry blossoms up here. I've got an angel with a sword.
just about make it out. Oh no, I can make it out. Yeah, yeah, yeah.
Yeah.
And do you and like why now? I don't have any tattoos because I like asking this question because I suppose just to kind of get the idea of why people are into them. Is it just like an artistic expression, or is it just, what are the reasons for the tattoos?
Yeah, it's a way of expressing yourself, I
Yeah.
suppose. I've always been fascinated by body art. Even when I was a kid, I couldn't wait to get my first tattoo. I got my grandparents got me an encyclopedia when I was young, and I've always loved history. Especially ancient Egypt, obsessed with.
Oh.
But I remember in this encyclopedia they were talking about tribal. There was a little bit about different tribes, and they were talking about tattoos and body art and all of that stuff, and it was fascinating. And I think it's a really nice way to express yourself.
I agree, and I think when I was younger, I always thought, well, I don't really love something enough to put it like permanently. This was my thinking at the time, like, and then I thought, well, I'd probably put the Beatles on it. Like that would be one thing that I'd be like I would stick on, and then it was like, oh, I don't know about the pain thing. So I've never got one, but like I think they're.
It's nothing. It's nothing.
Yeah, but you don't know how it. Give me 1 to 10. I don't really listen.
Oh God.
So listen, no, I want to ask you off the back of that. What do you like to do in your spare time?
Oh God, I do lots of things. I've got a lot of balls in the air at the minute, actually. But when I'm at home now by myself, I go for a lot of walks with my dog. I paint a bit. I like to draw. Play my guitar.
I knew music was going to be a thing of it. I don't know. I don't know if I've only chatted to you once, but I kind of got the impression that music was going to be something that's meaningful to you.
Oh yeah, music is everything. It's everything. I'm not a good singer though. That's the thing. I'm not. No, I'm not. But get me near a karaoke machine and I become Cher.
Cher, no less.
I swear to God, I do the whole thing. It's mortifying, and my friends hate me, but I don't care.
No, again, talking about like expression, self-expression and stuff, and it's fun. Like it's a lot of fun karaoke. I get that, but just kind of going back to the kind of the music thing, and it was always there. It was always there for me, I should say. And when I was growing up, was one thing, but when I was going through it, and I didn't want to go see people, and I didn't want to, I didn't want people to come over to the house. I didn't want any of that. Music was always there. Yeah, it like never, it never left. And even if you were listening to newer stuff that you hadn't heard before, or like the oldies that you were really comfortable with, it's always been very soothing to my depression and anxiety that I can sit there and listen to some good music.
Music heals us. It does. It's a fantastic healer. Music therapy, I've heard, is very good. But look, it's just I just sit down and just play around, mess around a bit with my guitar, and maybe write something. Maybe I won't, or maybe I'll just cry.
Yeah.
Yeah.
That's all right. Like and it's the guitar is something that's very mindful. I think when you sit down and you play the guitar, it's not you're not thinking about anything but the chords you're going to next, exactly. and I think that's so important as well, especially for kids as they're growing up to kind of learn a musical instrument, to have that facility there.
Yeah.
And I want to point out also my therapist today. We were chatting about mindful stuff, and he said walking his dog was the best thing. And you mentioned walking your dog, so you see, you're already, and that's free advice for you. That's free. Straight, I won't say my therapist's name, but yeah, it's a kind of, I think it's an interesting. Have you ever actually? This is one thing I did do, and you may not have done this, but you said about you don't read up about other disorders and things like that. But have you ever seen BPD represented on film or TV in any way? Because I was trying to think of. I want to do this like project for the podcast where I go through all these films with mental health that had mental focus on mental health, like The Joker being one, and there's loads. Obviously, I've got them all written down. I've never seen one for
Joker.
You are?
That was so sad.
I was sad. Yeah, it was
so sad. It was brilliant, though. It was absolutely fantastic movie. But it was. It did. It made me cry.
It was, and it was very deep for I suppose a comic book creation, not like but I couldn't find any for BPD, and I wonder if that's to do. They don't know what's going on with it.
Girl Interrupted.
Girl Interrupted. Yeah.
There you go.
I have that written. Do you know that I have that written down? And the reason I didn't put it to do with BPD because there's a few girls in it, obviously, and it didn't. Yeah, I did. That's one actually, and it's because it seems like this disorder hasn't been, do you
represented well?
And like when I talk to you actually, when I ask this question, when people find out that you have BPD, are you constantly explaining it? Because I think when I say bipolar, I think people have a kind of an idea what it is.
Yeah. Sometimes I do. If somebody wants me to elaborate on it, I will. If they ask me, I have no problem talking about it, but if they don't ask me, then I won't really go into it. I don't want to, start a whole conversation about my mental health with somebody, just out of nowhere.
But I love doing that.
I love talking about mental health and everything like that. But then you see, here's the thing about people with BPD. We could have a completely normal conversation and have a lovely time and feel happy within ourselves and feel secure for, a few minutes. Then the overthinking starts.
Yeah.
Did I say the wrong thing? Are they going to think this way about me? Are they going to, take something I said wrong? It's that's when the anxiety starts to build up. And then it kind of snowballs from there unless you literally snap yourself out of it. That's what I have to do. I just have to say stop, Sinead.
Yeah, and because another question I kind of had at the start, and I skipped over it, was like why you wanted to come on and have a chat about it.
Yeah, I think it's very important. What's going on now in the media. BPD there's already a stigma, I think, around personality disorders, and what's happening now, what's happening in the media with that trial and everything, it's very dangerous, I suppose, for people with personality disorders, because we don't have any good representation, not really. We don't have, well, look, there are a couple of famous people, comedians especially.
Really?
Yeah, Pete Davidson, that comedian, I think he has BPD.
Yeah,
Tommy Tiernan has BPD. I'm sure there are others, but they're the only ones I know about for sure. There's a program called My Crazy Ex-Girlfriend.
Oh yeah, I've heard of that.
She has BPD.
Is it not a good start when they call crazy in the title?
Oh, it's brilliant.
Is
brilliant.
It?
I love it. I'm nuts.
It's very. Do you know what? And sometimes I think for the people who do not have a mental health issues or anything, and they've never experienced it, when they hear somebody who does have some issues turn around and say they're nuts, I think that's quite comforting for the other person, because it takes the kind of the pressure off them. They feel less like nervous around the person.
Yeah, look, I mean, I'm not going to get offended if somebody calls me nuts, but if they're serious and they're trying to hurt me, then there's a huge problem. I won't tolerate.
Yeah. No, of course.
If I had a reaction, a bad reaction, and someone's like, "You're fucking crazy," I'm like, "Am I? Am I crazy? Why are you calling me crazy?"
Because it does, and well, look, people say to me, well, one or two people who I'm very close with can mess around with me about about bipolar, and that's fine, because I'll say something about them, something about whatever it is that they're hung up on. We're all hung up on something, I guess. But
yeah.
it's
but all love, man. It's all love.
It is, absolutely. And I think, I know this must have been a kind of a tricky thing to do for you, like, because, well, it's a tricky thing for anyone to do a podcast, but to be very open about your mental health and stuff, it's very easy. And I hope now, because you mentioned just there about like going away from it and overthinking stuff, that you're not like, leave all the worry to me, basically, is what I say. I'll worry about the podcast. But I think the thing is, if you think, like, is it possible for you to think I did a good job on that, and then to not go away and for it to turn kind of negative?
You know what? Recently, that started to happen for me.
Okay.
I have a very good friend who has actually become my best friend. We became friends. He saw one of the videos I put up one day. I was just talking a little bit about BPD, and I was just getting ready, and I was pissed off at the way people were being treated, so I put up a little video, and my friend contacted me and, explained, they explained their situation, and everything. And the fact that they could come to me, after, that was very comforting to me, actually. That was quite nice. But I can't even express what being friends with this person has done for me. It's having one good friend is very important. I've lots of acquaintances, people that I know, but I've never had a really close friend like that who doesn't, judge, my condition, or doesn't isn't afraid of it, or isn't afraid to ask me about it, and things like that. But yeah, he's a good dude.
I think
really good dude.
I think we all kind of need that. Just the like you said, it can just be the one that's so close. And if you need to if you're just having a day, it's to be able to talk to someone about it. It's so important. Sinead, you've been such a great guest to chat to, but I think more importantly, like, and I don't mean this to sound any way patronized or anything, because I know what it takes to go through something, to come on and talk about your personal life. It can be uncomfortable. It's a brave thing to do. So thank you very much for that.
Well, thank you for having me. I think it's an important issue. It's a very important issue, and I hope that, I hope that I got my point across all right, and I didn't, that I explained myself.
Yes. Well. No, trust me, you definitely did. I can assure you. Listen, just stay with me. I'll just close this out, and we'll get a photo at the end of that. Is that right?
Yeah, absolutely.
Brilliant.
Sure.
So I also want to say, as usual, thank you to John, who was back in jiu-jitsu this week after an extended break. But thank you for all the tech things he does for me. Thanks to my mom, my dad, my granddad, Jern Calvin. Subscribe to our YouTube channel if you would. We're on Instagram, Facebook, and Twitter. And all the podcast platforms, the usual ones: Apple, Spotify, Anchor, and Google Podcasts. Just type in the Weekly. They'll probably come up. I'm sure they will. So yeah, thanks everyone for tuning in and listening this week. And we'll be back obviously next week, as the title of the podcast suggests. And once again, Sinead, thank you.
Thank you.
Take care, everyone. Bye.